Good morning, esteemed panel, participants of Paper MedInfo, colleagues. I'm Dave Raj from Singapore, and I will be presenting my team's findings from our paper, Clinical Informatics Professionals' Training Needs and Job Satisfaction in Singapore. At this juncture, I would like to introduce the Integrated Health Information Systems Agency in Singapore. We maintain and manage around 800 IT systems, many of which ensure 24/7 delivery of services across various care settings, such as acute hospitals, community hospitals, and nursing homes. The span of the systems is wide and includes areas in electronic medical records, medical imaging, lab test results, medication dispensing, patient registration and billing, financial aid, community care, telehealth, and more. Every year, IHIS delivers an average of 1,000 new projects and enhancements to improve the quality of care for our patients and productivity of health professionals in public healthcare, and extend to private and voluntary welfare organization healthcare partners such as general practitioners and nursing homes. Collectively, this has benefited more than 12 million patient visits annually. With an increasing number of healthcare IT projects being implemented here, there is a growing importance on the key role of clinical informatics. Chief Medical Informatics Officers from the various public healthcare institutions are our key stakeholders, along with GCEOs, CIOs, and the Ministry of Health in rolling out health IT projects. With an increasing number of health IT projects being implemented here, clinical informatics professionals play an increasingly important role. Clinical informatics professionals analyze, design, implement, and evaluate information systems to enhance individual and population health outcomes, improve patient care, and strengthen the clinician-patient relationship. The field of clinical informatics is highly multidisciplinary, and the delineation of practice of clinical informaticians is continually evolving. In Singapore, clinical informatics professionals consist of those from various clinical backgrounds, including physicians, nurses, pharmacists, and allied health backgrounds. Due to a lack of a formal accreditation process and training paths locally, our team decided to conduct this study amongst local CI professionals to explore training needs, better understand job satisfaction levels, and propose actionable changes. We aim to do this through our survey findings and groundwork, which will form part of our final recommendations to the Ministry of Health's Chief Medical Informatics Officer. In this section, we will discuss our methodology. An anonymous online survey was designed using Google Forms, consisting of a series of questions with 3 main sections: respondents' background, education and training, and job satisfaction. Questions for section 3 were adapted from the 2016 Health IT Industry Survey by Mozani College of Medicine, University of South Florida. The online survey link was disseminated by the institution's informatics leads to all their respective team members. The survey was carried out in January of 2020. Based on our checks with the various teams, we had estimated a minimum of 120 full-time clinical informatics professionals working in the public health sector. We had excluded clinicians who were working part-time as user champions or subject matter experts. Participation in the survey was voluntary and anonymous, with no personal identifiable data collected. The survey was closed after 2 weeks, and data was validated and encoded into a spreadsheet for analysis. Interviews with Chief Medical Informatics Officers from the various public healthcare institutions was also conducted to glean insight into specific institutional needs, staff training requirements, and satisfaction levels. A total of 53 clinical informatics professionals responded, comprising 70% of nurses, 34% physicians, 23% pharmacists, and 6% from allied health professional backgrounds. The remaining 21% were non-clinicians and were engaged in pure information technology work. There was an even split of male and female respondents, as well as those from public healthcare institutions and from the IHIS. The charts provide a visualization of the demographic findings in our survey. As part of our demographic section, we also requested information on the respondents' previous work experience. Respondents were split on average by half between those from public hospitals as well as those from the Integrated Healthcare Information System Agency. Respondents represented a good range of work experience in both healthcare and informatics. We hope that this information will actually give us more insight into how we glean data from the findings. The next section of our survey focused on education and training. In terms of current training, we noted that 15% of respondents had postgraduate in a related informatics discipline, for example, biomedical or health informatics. 41% had attended introductory or basic courses, for example, the AMIA 10x10, while 37% had no prior training. These findings suggest a significant need to increase training and learning opportunities for clinical informatics professionals in our country. In this next slide, we see that there was a high participation rate in yearly professional education activities, such as conferences or journal clubs, with 81% attending at least one relevant conference or course in the past year. However, 19% did not attend any learning events at all in the past year. This emphasizes the point that there is still more to be done in terms of training. The survey respondents were further asked to select topics which they would like to learn in the coming year. They could select one or more of the following high-level topics for learning. This included clinical system implementation, which includes examples of software development lifecycle, project management, requirements gathering and analysis, or computing concepts such as programming, software, hardware, and network concepts, our healthcare delivery system, policies and economics, including models of care, healthcare financing, or clinical data standards, including the use of standards like SNOMED or LOINC, leading change, which included topics such as leadership and managerial training, communication, strategy, or user interface, usability, and user experience. Analytics, data science, and statistics included the use of artificial intelligence in healthcare. In this section of the survey, respondents were asked to rate their level of agreement to the following questions on a 5-point Likert scale. The majority of respondents found their work meaningful and were happy working in their clinical informatics role. This represented about 81% of respondents. However, only 51% of respondents were pleased with their career development opportunities, and 49% agreed that the organization looked after their professional growth. 20% of the respondents disagreed with this statement. 62% of respondents had no intention to leave their jobs in the next 1 to 2 years, while 28% were neutral in their responses, while 9% indicated that they might leave their jobs in the next 1 to 2 years. While the scores for job happiness and satisfaction appeared high, a significant number of respondents did not give clear indication that they would stay in their jobs in the near term. There could be other underlying push or pull factors which were not covered by this study, such as remuneration, intra-team relationships, and other factors. A future study can be designed to investigate these factors in more detail. Nevertheless, the results do suggest that more can be done to engage and retain existing clinical informatics professionals. In Singapore, healthcare professionals who desire postgraduate degrees in clinical or biomedical informatics often take up distance learning courses with American or European universities due to a lack of formal tertiary education locally. For short courses and programs, local professionals can attend the AMIA 10x10 course in Singapore or other short courses by the Center for Health Informatics started by the National University of Singapore. In our face-to-face interviews with chief medical informatics officers of several large public hospitals, they had recognized the need to retain and recruit more informatics professionals in Singapore as our healthcare sector has been expanding rapidly. They recognize the difficulty in hiring trained informatics professionals for public service. While health IT systems have certainly improved, as have basic informatics skills in health professionals, similar progress is lacking in number of more highly expert biomedical and health informatics professionals, particularly as we have seen locally. More needs to be done to positively engage our clinical informatics professionals with respect to professional growth, career development, and training opportunities. More needs to be done to engage those who are neutral by staying in the role for at least several years so that they are positive about doing so. Chief medical informatics officers also suggested that a career model or track for clinical informatics is necessary to attract and retain talent in this arena. Several CMIOs shared their views that implementing such career paths would result in more engaged CI professionals, as the employees would feel the employer is concerned about their growth. It was suggested that a clinical informatics career track will also provide the employee an avenue to reach individual career goals while fulfilling the company's or institution's mission. Several CMIOs commented that today's professional healthcare workers place strong emphasis on job enrichment, flexibility, and career development. Job security and stability by themselves are not enough. All of the CMIOs we interviewed expressed a concern that they believe the demand for clinical informaticians will be increasing in the next few years, and attracting and retaining talent will be an increasingly critical and difficult challenge for clinical informatics departments. Potential next steps include short-term job rotations and developing formal training programs in tandem with local universities. In this final section, we discuss our study's limitations. A relatively low response rate can lead to some selection bias and is a limitation of this study. This can be attributed to poor outreach, as we had disseminated the survey via a top-down approach and in a short period of about 2 weeks. In addition, no incentive was given to complete the survey. A larger scale study can be done in future to build on this study's findings, to look at other career aspects in clinical informatics. Nevertheless, the results still provided interesting and actionable insights that could hopefully spark some changes in our local setting. We have reached the end of our presentation, and our team would like to thank all organizers and participants of MedInfo 2021. Warmest regards from Singapore. Thank you and stay safe.